everyone. I'm Andrea Wagner. I'm the Oncology Nurse Specialist at Hackensack Medical University Center in Hackensack, New Jersey. I'm here at ONS Congress presenting Enhancing Autonomy, a nurse-driven Tocilizumab order in the setting of cytokine release syndrome with bispecific antibodies. So this is an important topic, especially with today's treatment landscape. Treatment in oncology is really moving towards immunotherapy, so our CAR-Ts and our bispecific antibodies, which is amazing because these drugs are effective, if not more effective than our traditional oncology treatments. However, they also have less toxicities in the long term. However, in the short term, we do worry about cytokine release syndrome or CRS. And how we treat CRS or we turn it off is with the drug Tocilizumab. So last year around March, all of our bispecifics for multiple myeloma and lymphoma were coming to market. So for our unit, which is a 19-bed lymphoma multiple myeloma unit, we wanted to get together as an interdisciplinary team. So our physicians, our nurse practitioners, management come together with a workflow that would be appropriate for the unit. So one of the things that came up is in the setting of CRS, how are we going to order Tocilizumab? So Tocilizumab does fall under the umbrella of chemotherapy biotherapy, which per ONS guidelines and Hackensack guidelines, we do not take verbal orders for. However, given the emergency of the drug and its treatment, we did want to come up with a workflow where it was not a full verbal order, but it was a workflow that was efficient and allowed the drug to be ordered and delivered and administered efficiently. The workflow we came up with is that on admission, patients would be consented to Tocilizumab. So if and when they needed Tocilizumab, the consent would be in the chart. Also, the provider would enter a physician communication order into the EMR that would say, upon confirmation of CRS from the provider, the nurse would order Tocilizumab at X milligrams, and the milligrams is patient dependent. So if a patient did go into CRS or suspected CRS, the nurse would call the provider. The provider would say, yes, administer Tocilizumab, and the nurse would basically take that physician communication order and transcribe it as an official order to pharmacy. So this workflow was in place from March 2023 to March 2024. It's still in place today, but this data goes to March 2024. We treated 68 patients with bispecific antibodies, so about 75% were for multiple myeloma patients, 25% for lymphoma patients. And of those 68 patients, we did administer 38 doses of Tocilizumab. Now, of those 38 doses, 21 doses used this workflow, meaning that the nurses took that physician communication order and transcribed it to a Tocilizumab order. The other doses were either ordered by a physician or a nurse practitioner for whatever reason may be. The physician was on the floor, nurse practitioner was signed in and just ordered the drug while they were logged into the computer. So one thing we looked at here, knowing that a little over 50% of the doses used the protocol, was that what was the timeliness of administration of the Tocilizumab. So what we saw is when nurses utilized the workflow, 92% of the doses were administered within 1 hour of identifying CRS, which is really the gold standard. When we looked at physicians ordering the drug or nurse practitioners, that dropped to 60 to about 80%. So we really did see that utilizing this workflow got the patient Tocilizumab more efficiently and quicker than having someone else order the drug for the nurses. With that said, we also did not see any medication errors using the workflow, which is obviously great for patient safety. So moving forward, we are continuing to use the workflow. We have shared our results, so we are actually pushing to use the workflow more, given that, again, it's more effective and more timely treatment of the CRS. And we also hope that, and again, with the changing landscape of oncology treatment, that we can use this workflow for new drugs coming out as well. For me, this really is a display about nursing autonomy and how really great it works in the setting, is that nurses are capable of recognizing CRS and really the steps that need to come with it. So, alerting the provider that suspected CRS is occurring, and then having the autonomy to place the order for the Tocilizumab, following up with pharmacy and making sure that it is administered within that 1 hour. So I think for nurses out there, physicians, it really is a great way to involve the nursing staff and again have autonomy of their practice. Again, we saw the results that this was more timely treatment. I mean, I think it's just a great time to be in oncology. The treatment landscape, again, is changing so much, and immunotherapy really is the future. So, thinking about different ways that we can help get these patients through the cytokine release, through neurotoxicity as efficiently as we can, is going to be very important in the future.